Perfect. Okay. My name is Auyeung. I am a second year internal medicine resident, University of Central Florida, affiliated with HCA Consortium based in Gainesville, Florida, which is north part of the state. I'll be presenting a case of leprosy in North Florida, something we don't really see too often in the United States. Thank my team, Dr. Sohail, and my attending infectious disease specialist, Dr. Kima, for the help with this project. So let's dive into a little bit of background on leprosy. So leprosy, or historically known as Hansen's disease, chronic bacterial infections, been around for a very long time, going back to BC, caused by Mycobacterium leprae, something that's been known for a while, but something that's a little bit more recent. Mycobacterium lepromatosis is something that's more recently been discovered that also gives or confers leprosy to patients. Common manifestations, anyone who's been through med school knows that you get the typical skin manifestations, plaques, nodules, stuff like that. But in some other cases, depending on the severity, can also affect the nerves, mucous membranes, bones, testes, and eyes. And if we're looking at leprosy on a global scale, before we jump into the prevalence in the US, it's about less than one per 10,000 people. A lot of these cases are concentrated in places like India, Brazil, and Indonesia. But within the States, for the past 10 plus years, we get about 200 cases a year. So a little bit more about the transmission of leprosy. Human to human contact, not that common. It's not actually that contagious, but it has been reported. Consumption, maintenance, preparation of armadillos has been linked to the transmission of leprosy. You can see our two friends here. On the left, you have the Eurasian red squirrel, more commonly found in the British Isles, where they are actually a zoonotic reservoir for the more recently discovered Mycobacterium lepromatosis and not Mycobacterium leprae. And that was about 2008 that was discovered, this second zoonotic reservoir. And the armadillo is a known reservoir for Mycobacterium leprae. We see them very commonly in Florida, running all over the place. So let's get into the patient that I saw. This is a 55-year-old female living in North Florida, never left the country. She developed this non-specific erythematous rash on her bilateral upper extremities in 2022. She was actually initially diagnosed with granuloma annulare. That was purely based off a clinical diagnosis. No real tests were done, no biopsy was taken at that time, and she was started on topical steroids, triamcinolone. 2 months later, however, the lesions unchanged, she actually started developing new lesions, so continued to worsen, warranted further workup. She got a first biopsy, which confirmed Hansen's disease with H&E stain as well as PCR, but acid fasting did not show anything significant. She wasn't really that convinced. She looked it up. She wasn't, how could I be one of these one in a million cases in the States? So she got a second opinion. They got a second biopsy, again confirming the presence of Hansen's disease. And interestingly to note, in her history, never traveled outside the United States, like I said, no contact with armadillos, squirrels, other rodents, nothing really to say, point us in a direction as to where did she really contract this disease. We weren't sure. She works in finance, doesn't spend much time outside, um, no chemical exposures, and nothing to really say in her recreational activities or other parts of her social history that she would have had any significant contact to explain why she has Hansen's disease. And just for the sake of completion, vitals wise, nothing really remarkable there. Nothing really to help us point us in a direction that would explain what's going on. So here's some of the clinical manifestations when she actually first presented to the clinic in 2022. You can see she has bilateral skin lesions on the upper extremities, flat plaques, erythematous borders, and central clearing. She described these as mildly irritated, but not really pruritic, not really causing issues except for the obvious what you see on her skin. And she developed some lesions on her right shoulder as well as the right forehead there. But in terms of limiting her life and daily activity, right, activities of daily living, no real impact there. So from one of the biopsies that was taken, you can see here, these were taken from the bilateral upper extremities. One on your left was taken from the left upper extremity, one on your right upper extremity. You can see there's diffuse granulomatous inflammation based on what they're seeing here and what's been shown. It's all over the tissue, really. It's more granulomatous inflammation than there is normal tissue. So further into the workup, we looked at serum vitamin D levels, which were normal, hepatitis screen normal, and TB quantiferon, which was unremarkable. At this time, when she was diagnosed with Hansen's disease, we prescribed rifampin 600 milligrams, moxifloxacin 400, and minocycline 100 milligrams to be taken on a monthly basis, anywhere between 6 and 12 months. Treatment's still ongoing, given the typical long duration of treatment for this disease. 1 month after starting treatment, she actually continued to develop new lesions on her arms, forehead, right foot. But treatment remained unchanged given the indolent nature of this disease. And then I guess a month later, 2 months after initial presentation, the size and number of the lesions remained unchanged. But the issue was she started to develop these paresthesias in both her hands. So she was started on methotrexate as well as low dose prednisone to address that, likely a sequelae of leprosy. So what are the significant discussion points from this case? Well, the one thing that really stands out to us here in the United States, she had no traditional risk factors, nothing really that we could pinpoint, nothing we could latch onto to explain why she had leprosy, something that we rarely see in the United States for the past, several decades. No international travel, no travel to endemic areas, no exposure to the typical animals. There are armadillos in Florida, but asked her a couple times, doesn't have a farm, doesn't do anything with armadillos. No contact with people who have been to endemic areas or are known had confirmed case of leprosy either. So we were really kind of at a loss at this point. So diving a little bit more into the literature, we see that there are some cases out there that suggest similar cases to ours where patients within Florida, specifically usually Central Florida, Western Florida, they're actually presenting with leprosy without these traditional risk factors that I talked about. Never left the country, never touched an armadillo in their life or anything like that. Um, and this is actually not just one case, but it's been mounting slowly. But given there's so few cases in the United States, the body of literature is still quite scant at this point. But there was a case of a Canadian gentleman, not United States, but over the past 8 years prior to his presentation, he was traveling to Davenport, Florida, which is western part of the state, annually for 8 years. Um, and when they actually discovered he had leprosy. So all of these kind of connect to Florida being a place that you may want to stay away from if you're concerned about leprosy. So um, going a little bit back in time, the cases of leprosy since the year 2000 in the U.S. have doubled, concentrated mostly in the southeastern states, Florida being the most south and eastern state in the country. Annual incidence between 2002 and 2014 in Florida has been 5% of the total national number of cases. But since then, between 2015 and 2020, that's actually bumped up to 12.3% on average, while the national average of cases has remained unchanged. And there's also data to suggest that there hasn't been an increase in immigration or anything like that that may be affecting these numbers. So the cases within Florida, tend to be concentrated in the central region, kind of Orlando, that area. Um, and of the cases in Florida, about 81% in 2020 and 64% in 2021 were concentrated in those regions. And just for reference, there's about 20 cases or so in Florida annually for the past 7, 8 years. So to conclude, for any clinician, especially in the United States, who's concerned about a rash, although not common, you're concerned about Hansen's disease or leprosy, you should really be asking your patient, have they traveled to Florida? Have they been to any of those areas, even southeastern states? That should be part of your social history to kind of narrow it down because it seems like the evidence is starting to mount that for whatever reason, leprosy is becoming endemic to Florida, and we're not 100% sure why that's the case, but it seems that way because numbers have not gone down in the past 7, 8 years. And given the slow progression of this disease, I don't know exactly what the kind of the next step is, but you may want to consider another zoonotic reservoir. Maybe it's in the soil. There's other theories that, still have to be kind of ironed out here, but the Eurasian red squirrel was only discovered 15 years ago in 2008. That was in the British Isles. So, and this disease can lay indolent for 15, 20 years. So for all we know, it could be out there and we're not sure where it is, but I think, this warrants further research. And with that, I thank you for your attention. I'll take any questions.
Thank you very much.